We have heard the alarm bells, folks telling us our local hospitals are overcrowded, stressed. Today, a concrete example of what the consequences of that can look like. News 8 learned Thompson Hospital in Canandaigua twice last week had to refuse patients, sending them to other hospitals. But what happened when they tried to divert them to those other hospitals? Yet another sign things are critical all over. Christian Garzone joining us live outside of a local emergency department with what all this means. Christian.
Well, Adam, Thompson did say they enacted diversions on November 16th and 18th due to a high number of patients who needed intensive care. They had no room in their ICU to move these patients out of the emergency department. In short, when they made the call at the time, there were no other beds available in all of Western New York. Hospitals alert the state when they want to make a diversion. The state then alerts emergency medical services to bring patients elsewhere for a set period of time. Thompson said they were informed there were no ICU beds available in all of Western New York last week, twice. Thompson said this was because many hospital patients have been waiting to get placed into nursing homes, but there's a serious lack of beds in those facilities. Thompson said in part in a statement their two diversions were due to several patients in the ED who were awaiting admission to the hospital, adding, "When we tried to transfer these patients, there were no available ICU beds in Western New York." The Department of Health says a diversion happens when the current emergency load exceeds an ED's ability to treat patients promptly. Now, Thompson Health wants to make clear they will never turn away an ambulance, so if one arrives with a patient in an emergency, they will, quote, absolutely still provide care. Now, we did get a statement in from Senator Cooney's office, obviously here in Monroe County. He says, quote, this is troubling news that comes at a time when we're seeing COVID-19 cases rise across our state and country. While workforce shortages remain a major issue for hospitals and care facilities, we believe the science and the health experts who tell us that we're all safer when we're all fully vaccinated. Live in Rochester, Christian Garzone, News 8. Adam, right back to you.